And welcome, everyone, to another edition of The Natural Nurse and Dr. Z. This is Dr. Z. I'm really glad to join you today to bring you information and cutting-edge wellness from all over the planet. Many different guests and folks have been on the program, and we've been doing this show for a while. Myself and Dr. Kamai have been doing radio since, I've been doing radio since 1982, I think. So we're veterans in the field, and we're really glad to share this great information with you. And you can always get more information on our websites. That's drznaturally.com and naturalnurse.com. So today we have a very interesting guest. He's a conventionally trained doctor who practices integrative medicine on performance athletes. So I'm going to ask him some questions about training there. But Dr. Jaime Salas Rushford is going to be our guest today, and he completed residencies in New York's preeminent hospitals, St. Vincent and Mt. Sinai, and he went on to open integrative centers in Puerto Rico and treating patients in New York City, Florida, and also Puerto Rico. And he's interested in anti-aging and regenerative medicine. And we're going to be talking a little bit about COVID today, but we're going to be picking Dr. Rushford's brain about many different topics here. So welcome, Doctor. How are you?
Pretty good. Thank you for having me.
Very welcome. So, hey, I hear you work with a lot of athletes and fitness, and you're director of Fit Body MD Medicine. So although I wanted to ask you some questions about training as people get older, like myself. What are some of the really good exercise you recommend for weight loss and maintaining weight and muscle as people get a little bit older?
So what I did internal medicine, and then I went into all this wellness part. And as you know, I focus myself in the performance part. I tell my patients, I see patients not that they're sick, they're out of shape, and how can I make their body more efficient? So I try to cater each and every patient that I see individually in a way to see what they're lacking nutritionally, hormonally, and exercise-wise, and just cater to it. But basic stuff, I try to teach patients what really aerobic exercise is. What does it mean to have your heart rate doubled? What does it mean to keep your heart rate at a specific rate? Mm-hmm. And what does it mean to get that cardiovascular exercise? Everything else depends on that cardiovascular pump, right? It's going to take your nutrients, it's going to take your oxygen to your muscles, it's going to make you stronger, it's going to make you healthier. So how can I take that essence of heart pumping to another level so you can be more competitive? Doesn't matter what age you are. I have patients who are 79 and they're doing triathlons. So it's like fine-tuning a car. Like I tell my patients I'm the doctor for the Formula One racing instead of like the regular average street car. And how can I take that Formula One science and apply to street cars in a way that it improves it. It doesn't take it to a level that is unhealthy, but improves it in a way that you feel better driving your car down the road.
Have there been, in your research, have there been some interesting work on like interval training, like just doing like wind sprints versus just like long distance things for fat burning and fitness? I've heard, pros and cons of course, cardio and long distance, like it's tough on the joints. Of course, it's, I guess there's pros and benefits for every type of exercise.
Yeah, for me, 80% is diet and your lifestyle, and 20% is what you can achieve exercise-wise, because you need a good fundamentals of what nutrition you have, what process of anti-inflammatory you have, what kind of recovery mechanisms you have through sleeping, through different supplements and medications, and how can you integrate that into doing a very efficient exercise. A lot of people do exercise, but it's not efficient, or it's not in a state of body that you take advantage of it. A lot of people, they don't sleep, they eat badly, and they just think they can just run 3 miles, and then running 3 miles is going to be all they need. So that's not the case.
Right. Or vice versa, people that take the vitamins and things like that, but they don't do any cardio or exercise. So you get those folks too. I see as well.
Yeah, we have we have what I call the over nutritious, that they think they can take every single supplement there is in the shelf Yet that supplement's there for something, either to build muscle, to give you energy, to help with recovery, and you
Right.
need to pair one thing with the other. One of the things I tell my high end athletes is there was this proteins need some time to digest. So back in the day, there were a lot of protein shakes, like true proteins, complex proteins, not amino acids. Now we have amino acids and hydrolyzed amino acids and so forth. So they took a protein shake. Uh, they took a protein shake, and they wanted to go and train immediately. And I said, well, you need to have that protein digested into amino acids to take advantage of it. So it's still kind of things that you teach patients the ins and outs of that mechanical part and that science of athletes, so they can
Right.
get it. They know when to do exercise, what to eat, and when to eat it, so you can maximize the usefulness of whatever you do with your body or put into your body.
What about hormones? Do you work with hormones with your patient? I mean, we're all leading up to COVID because a lot of these things we're talking about, I believe, and you too, my training as a naturopathic physician and your training as an integrative physician, kind of look at the person who has the disease, not the disease the person has. And that, of course, is like a
Correct.
paradigm shift in looking at viral susceptibility. So we'll get there. But what about hormones as we age? Is that important for keeping young?
I think there's a big thing that I tell my patients, which is I do hormones to supplement what you're lacking, not to replace it. Okay, I don't think like there's a big topic. Everybody's hormone replacement therapy. You'd still produce hormones as you age, but given lack of exercise, increased belly fat, increase less activity, different diet styles, your body can actually shift how it uses hormones and what does it produce. If you have a male, for example, and you have a 55-year-old male with a big belly, a lot of belly fat, that fat is going to actually increase estrogen production and increase testosterone use. So you have this 55-year-old male who can be able to be fit, yet he has all the complications of chronic fatigue, of depression, of lack of libido, and everything else. And it might not be due for lack of testosterone, it might just be due for an excess of production of estrogen. So yeah, I do measure all those hormones and try to teach patients what do they have in excess, or how can I supplement whatever their body's not producing. Once you start replacing hormones, there's a lot of mechanisms in your body that shut down. So if I give a male a lot of testosterone, the body, it makes it hard for the body to auto-regulate when it needs more or needs less. So yes, you're right. A lot of people need hormones as they age to keep with their active lifestyles, but they might not need as much as they think they need, or they might need something that they're not seeing right evident in front of their face. They usually associate males with testosterone. I see the contrary. I try to increase their estrogens to a point that the testosterone plays a more important role, and they feel better without exposing, with all the side effects that it might have for overusing steroids and or hormones.
Right. And then, of course, dealing with stress, because that's the big stealer of hormones and the stealer of health is trying to teach mind-body approaches to stress, and maybe doing some other meditation and breathing, or I like to use, Bach flower remedies and homeopathy, and using adaptogens to help people deal with stress, because that dovetails us into the immune system too, because with COVID, the mainstream media has really spent zero time talking about what people can do, how do you live, what do you do to really reduce your susceptibility to viruses. If you hear the mainstream guys spout, there's not a lot you can do besides cover your face and avoid people. And although that is part of preventive medicine and contagion, that's not what's been done for millennia, first of all. And second of all, it's sort of is this kind of paradigm that it's like us against nature versus humans living in harmony with nature, a more vitalistic philosophy versus mechanistic. Like it's drug for every bug, a pill for every ill is the more the mechanistic thing, and it's the vitalists are more working with nature, in harmony with nature. So I know you've worked a lot with COVID. Tell us a little bit about your experience with COVID, working both in the hospital and other patients and things like that. We have a unique opportunity to hear your story here. So
you're totally right. I was at an interview the other day, and I think media what's been teaching us is how many cases we have, how many people might get infected, but they don't teach us. It's not educating what to do if you get COVID, what to do to try to get your body in a better position so you don't get as diseased if you get the condition. The reality is almost everybody's going to be affected by COVID. There's no escaping it in a way, to be in a realistic way. In an ideal world, you can play all scenarios and get in a bubble and hide. But in a real world, when you need to go outside and do different things, everybody at one point might or will get COVID or be affected by it. So how can we as physicians, how can you through the radio, how can we shift the teachings of, how, in case of, instead of saying how many patients do we have COVID in the world, what do we do, or how does your body work with COVID? I think we now need to know or go into a program of educating the public. Or what does it mean to take vitamin C? What does it mean to walk out? What does it mean to, some people have even, take other things like mushroom extract, the AHCC, it's good for the flu, and they're bringing it in to use at COVID. So those kind of things, it's what we need to teach people, how to inquire about information, how to teach, like in layman terms, medical information to help them live with and fight COVID. And you're totally right. As a physician, for me, it doesn't really matter how many people get COVID. It just matters how can I teach people on how to be safe and how to respect their body. And that's going to get me a healthier patient versus knowing that 4 million more people got COVID versus what can I do with the other people that haven't got it and teach them the right way.
Well, the germ theory shows that, I'm also a physician, see a lot of patients at the University of Bridgeport, where I'm a professor. And so, there are times during viral epidemics of cold and flus in the wintertime where people are coughing on me left and right. You're looking down people's throats with strep throat, things like that. Yet, knock on wood, most of the years I could count on one hand, not even one hand, the amount of times I've been ill over the last 20, 30 years. And so I don't think that's by accident, although conventional thinking thinks that that's accident. It's like the germ theory is you're exposed to the germ and you get sick. That's not really reality, though.
You harvest what you put in the ground, right? If you're working with a good body, eating healthy and everything, 20 years from now, your body's going to be healthier to combat any condition. There are exceptions like everything, but in the majority, whatever you did when you were in your 20s and 30s is going to show when you're in your 40s and 50s. So, yeah, you have to be conscious about respecting your body. And I think COVID, and one of the things that is very interesting. Yes, COVID is a new virus, so nobody's immune to it. But on the other hand, before COVID, back in November, if people got a fever, got sick, shortness of breath, they just hunkered down in their bedroom, and how we say, sucked it up. We took their Tylenol. We symptomatic treated. Once the word COVID came into our jargon, right, day to day, there's this fear factor that came in. That stress that you're talking about. Now people think everything is COVID. And then now you have this stress added to the disease. And to what point that stress of people not knowing what's going to happen to them adds to them not getting better or getting worse. So I always tell patients, you need to respect the disease, but not fear it. The fear is going to make you make wrong decisions and not make you, it's not going to make you healthier. But respecting that condition is going to actually allow you to think clearer and get a better aid from your doctor, primary care, or whoever you need to get help from.
And when you saw a lot of people with COVID, there seems to be, what are some of the characteristics of people that did poorly with COVID? Because, you see, that's what we should be studying, not just the fact that there's a virus, but who does poorly and what's their nutritional status, what's their genetics, what's their toxicity load. None of that is being studied in public health. It's all about just wearing masks and things like that. No one's looking
Correct.
at, that I know of yet, any studies, looking at a group of people that got over COVID and what was their immune status like, or what were their comorbidities, I think is what they use in preventive health, the right word. So what have you seen?
If we take out the elderly, right, the 75-year-old and older population, which have many multiple conditions, if you take them out of the equation, because obviously that's a more complicated scenario, a lot of those are going to get either COVID or flu, and they might do poorly with either one. So, of course, they're elderly like my father, who's like done exercise all his life. He's like hard as a rock. So in that sense, we stay with the regular population. What did I see? What I saw was you can be healthy, you can take all your supplements and everything, and yes, those people are more in tune with their body and are able to get help quicker. And they had a lifestyle that promoted health. So, it's not only taking your vitamins, it's a lifestyle that entitles your train of thought, your mindset. But the other people that did poorly were the people that were high stressed, those workers that had 3 shifts in a row. So for me, that fear of COVID and that stress level of just getting fever, knowing there's a deadly disease out there, also played a very significant role in, not letting them get help or or just stressing themselves out to getting sicker. So, and you're right, that component has not been studied or seen, but that was my experience. And I saw thousands of patients in Brooklyn. I was in Coney Island Hospital in Brooklyn. I think it was the second or third busiest hospital in New York State as a volunteer. I went there for 10 days, ended up spending almost 3 months. So it was hard to fly out, a lot of situations, but I decided to stay. And that was it. It doesn't discriminate, but if you have the right mindset and you do your exercise and do everything else, either that is going to help you or the right mindset is going to actually promote you to look for health versus just going nuts of something bad is going to happen to you.
Right. So a lot of that is from education and not fear. And the problem, like I mentioned, is because we're not hearing a lot of doctors talking about these types of things. We're just hearing, wear your mask and wash your hands and stay away from people. And that's from the top trickling down. Only on, programs like mine and a lot of other, smaller programs like this are we seeing that there are some other things that people can do. Like, for instance, it's a fact that they're starting to use more vitamin C in the hospitals. I have the documentation that shows that that's true, that there's certain hospitals that they're doing IVs. Yet that's not promoted because there's no money in doing IV vitamin C. I think a lot of it boils down to that and what I call politics.
But look, what happened in my hospital, or what happened in the people I chatted with during my stay in New York for this. One thing is using vitamin C because you're trained, or using, AHCC, or using vitamin D for that point, or using other different immune modulators. One thing is to use them because you know their mechanism, how they work. The other thing is to use them because you have no other option. We're throwing everything in the sink, everything but the sink.
Right.
And I think that's what we saw. We had doctors. I'm traditionally trained. I'm an MD. If I don't have a patient with a disease or a symptom, I don't know what to do. I was not trained to promote health. I was trained to treat disease and symptoms. Now, obviously, you and I learn differently. I tell patients, again, they're not sick, they're out of shape. How can I get you back? And I try to improve health versus cure disease, which is a different way of thinking and seeing the patient. But what happened to all the supplements that people were using in hospitals? They were using it because they had no other option at that point. There was nothing else. And it shouldn't be that way. It should be because I learned how to use nutrition to help people. Doctors should be trained in nutrition, and it should not be called alternative medicine or different medicine. It is plain and simple. The biggest prescription medication that we can give a patient is food. Food is like a medication. You need it 3 times a day. You ingest it by mouth. Instead of taking a pill, you take your lettuce. So it is food as a medication, but they don't teach us that in medical school, how to use that kind of support to help the patients. And yes, my hospital ran out of vitamin C, but when I asked my colleagues, look, why do you give vitamin C? Because I don't know what else to do. And that should not be the answer. The answer should be, things like, again, vitamin D. People don't know that vitamin D, if you have enough levels, can actually modulate your immune system. And it's not a vitamin, it's a hormone. But we can go into all the inner workings of technical terms. But at the end of the day, people should know that information. Doctors should be taught that information as to use it as the same way they use an IV. And that was my biggest paradigm and my biggest, kind of argument that I had day in and day out in the hospital.
I think that alternative physicians and naturopathic physicians, trained at accredited places, need to have a place at the table to make public policy. But the problem is that they haven't really invited us to the table to talk about these things. So that's why we're talking about these things now. Like, what are some preventive strategies you've been telling other people to do in the fight against COVID,
COVID is a very interesting disease because we moved as a society in the U.S. to be very specialized. We needed to have a doctor specializes in the little pinky. That's all they do, right? Or just the hair in the back of the ear. I'm exaggerating, but yeah, we're moving into very specialized, very highly technical doctors. And COVID is a primary care disease. COVID is something so primary care that it exposed ourselves to the weakness of not having a good primary preventive care medicine in the U.S. And I think you're right. A lot of wellness and preventive doctors were not invited to the table. But here we have a pandemia that there's no surgery. You cannot operate COVID out of the body. You cannot bring a robotic arm and just take out COVID. This is very basic medicine that we failed in the most basic sense. And I was talking in Puerto Rico, they were like, we need to do a lot of testing and everything. Yes, testing is important. But if you take those old-fashioned doctors, the pediatricians from the little towns, those doctors can see their patients a mile away, can say that patient is sick or is getting sick. And that kind of clinical eye, we're losing it. And COVID, one of the things that we need against COVID is that clinical eye that we're losing as physicians, that hands-on, knowing your patient, primary care, wellness part. And, I as primary care physician myself, I have patients for 15 years. I can see them, I can listen to them on the phone and say, you're getting sick. You don't sound right. And that is what COVID brought about. It brought the light that we need that primary care basis to be rebuilt. Yes, we need specialists. We need very complicated, highly technical physicians like colleagues, and I admire them. But we also need that clinical basic eye to identify things very early and be able to guide them the right way.
So what types of immune supplements are you using and recommending for people at this point? I have my list of things that I've studied. I'm trained in traditional Chinese medicine, and of course I teach botanical medicine at the University of Bridgeport. So my knowledge of herbs is very well versed in herbs and things like that. But there's a lot of other things that are interesting, like mushrooms. And I know you've been studying extracts of different mushrooms and finding that they're very valuable. So why don't you tell us a little bit about some of these immune supplements?
So I do a lot of laboratory work in my patients, first of all, and I try also not only to give them the immune supplements, but the nutrition they need. So I try to identify from vitamin B12 to B1, different minerals and vitamins that they need. So I cater to them. We have the technology to identify what we're lacking. That's number one. The biggest thing that I tell patients to fight a virus is hydration. So we start with hydration, and then we work ourselves down to the supplements. People are not adequately hydrated. They become dehydrated with fever. They're not adequate, that we need a lot of water and need electrolytes and need hydration supplements in a sense of different juices and whatever you want to use. But number one would be hydration. Second from that, I give my patients from vitamin C and zinc, which need to go together, as you know. I give vitamin D and make sure they have adequate high levels to work as an immune modulator. And also I've been using AHCC, which I been using for several years with some prostate patients that I had. And also it works, it's been working a lot. It has great clinical studies with the flu. Yes, coronavirus is not the traditional flu, but AHCC I started using with athletes because it also has an anti-inflammatory component to it. And I wanted to decrease inflammation with my athletes. And I started noticing that my professional athletes taking the supplement had, less inflammatory levels, less lactic acid. That joined with different probiotics worked beautifully. One of the cases I tell people is my dad is 80. My mom is a bit younger. She got COVID. She got very, very, very sick. My dad has been taking, this mushroom extract, AHCC, for close to a year because of the prostate cancer. I wanted to treat him both traditionally and non-traditionally, and thank God he's great. He went through all the radiation, and he recovered very, very quickly, even quicker than the doctors expected. He never got COVID, and they sleep together, So I've noticed that my private patients have been adherent to both AHCC and their regular supplements, and they have that day-to-day routine. If they got COVID, got less symptoms, or they had no symptoms at all, they didn't get it. So it's about consistency. Whatever supplement you decide with your doctor to take, you have to adhere to a regimen. You're not going to take vitamin and be healthy. You're not going to take AHCC for 2 days and be good. But you need to adhere it and say, from now on, this is going to be my regimen. I'm going to do my budget. I'm going to do my mental note that I have to take all this from now on.
So mushrooms have been used for thousands and thousands of years for immune health. I mean, in my book that I wrote with our co-host, the natural nurse, we talk about, some of the most incredible mushrooms, whether it's reishi, which is Ganoderma, maitake, shiitake. These have been used for a long time to communicate with the immune system, with the alpha-glucans, which is that polysaccharide that helps communicate with the immune cells. But it does a lot of other things too. So tell us a little bit about some of the clinical trials on mushroom extracts, particularly and what does it stand for, AHCC, and what types of mushrooms do they get it from?
Well, AHCC, it's basically they take the shiitake and they take the mushroom and they take the essence of it. It's how they extract the glucans and the polysaccharides, and how they extract the ingredients. It's what's key. A lot of the nutrients, and I have to say this, a lot of people take just random nutrients, right? And random, let's take, for example, iron. A lot of people take iron, and there's chelated minerals and they're non-chelated minerals, as you know. And chelated means that you can have them better absorbed, and non-chelated is more difficult for your body to absorb them. So it's all about how big or small the molecule is and how it can interact with your body. One of the things, and you mentioned, I think, a minute ago, one of the things of the mushrooms is very important because they're immune system enhancing, but they're also immune system modulating. And that modulation is one of the key factors of the alpha glucans of the AHCC. And that modulation, what it means is actually helps the immune system organize itself and how it is going to attack whatever bug it faces. As you know, we originally thought that COVID created a haywire. It made our immune system go nuts. And then we have all this cascade of coagulation and everything. To a point, it did. And to another point, their studies say it doesn't. But what happens with a novel virus or something new that increases your body is that your body is very hard to really organize itself and be able to fight it. And I think that's one of the things that this coronavirus is actually creating a lot of havoc. The body doesn't really get organized in a good way to fight it out, versus the flu that we've been exposed to different strands of the flu. And the body says, well, I don't really know this specific strand I got this year, but I know it's the flu, and I kind of know how to organize myself and fight it out. So that's what basically it does when you talk about immunomodulation. The AHCC basically it's an extract of a mushroom, Lentinula edodes, if you want to go very technical, and it's rich in alpha glucans. A lot of people use beta glucans. Alpha glucans have a better affinity and absorption. So that is what actually creates better immune modulation for the body. Most of the studies have been done in two major groups, in prostate cancer and in influenza. It's been shown to actually decrease symptoms and act as a super potent vitamin C in the flu-like symptom. And also for prostate cancer, it decreases that it helps the body build the immune system in a way that it can actually, I'm not going to say kills cancer, but it helps control a little bit the spread. So we, with traditional medicine, can come in and actually win the battle when we cut it ahead of time. Obviously, there are exceptions, and the most important thing is people, if they get sick or they feel they're unwell, the quicker they get diagnosed or the quicker they can actually get help, the better, especially with COVID. If you have symptoms of COVID, the quicker you can control your fever, dehydration, vomiting, diarrhea, the better you're going to be in the long run, and not stay home for 2 weeks and then, go completely dehydrated to the hospital trying to get saved, because that's going to be very hard for a doctor to bring you back.
Right. Well, we're going to take a quick break and play our natural medicine chess. When we return, we'll talk more about mushrooms and the various extracts and how they help with or booster infection or help infection, inflammation, and malignancy, their effects on T cells, and some of the other conclusions. So stay with us, folks.
Hi, I'm Gary Null, and I'm happy to be just one of the many voices speaking truth to power every day on the Progressive Radio Network. We have dozens and dozens of the finest minds in the United States, people who've spent their careers helping, first and foremost, bring justice to issues. Ralph Nader, Jimmy Dore, Gerald Salante, Utrice Lee. From all communities, we look at what is the truth. We are not right. We are not left. We're not card-carrying members of any party. We may have been at one time, but today we're just looking to how we can cut through all of the nonsense. Occam's razor, the philosophy of cut through it and get to the truth of it. And generally, it is the most direct and honest answers, and that's what we seek. Because progressivism is to seek the truth without having to first monitor it with some ideological identity. No, the truth doesn't need an ideological identity. It just needs good spokespersons to bring it to you. And we have that at the Progressive Freedom Network. We challenge Big Pharma. We challenge the big industries like Monsanto and DuPont. We challenge Wall Street and the banking community and the energy cartels, nuclear, high gas hydrofracking. We challenge all of them every day, 24/7. This is a place to come if you can handle the truth.
And we're back with more of the Natural Nurse and Dr. Z, and we're discussing all things about virology and the immune system here with Dr. Salas Rushford. He's a conventionally trained physician who's kind of crossed over to practice regenerative and functional medicine. And during the COVID pandemic, especially when it was really hitting New York, he worked on the front lines with patients in New York City and Puerto Rico, and continues his study of this. And we're talking about this really interesting mushroom extract. And so let's talk a little bit more about that. So there are some actually human studies on this particular mushroom extract, because, a lot of times they say, particularly the naysayers say, there's no, there's been studies on rats and things like that, but, there's no studies on humans, and so we can't use it. So this is kind of what I hear all the time, or there's just no literature on it. But yet, if you go on PubMed, National Library of Medicine, and you search AHCC, there's a plethora of evidence that we should be using these types of things, yet it still kind of goes on deaf ears. I think that's more about politics than anything else, Doc. What do you think?
Well, I think it's also the world, this side of the world's a strain. Again, we are a pill for every condition, like you said at first, versus in the other side of the world is about what they have. It's an older culture. It's, there were not pharmaceutical companies in China or, for that sense in Europe, and people had to depend on, like, for, the poppy seed when people got pain. We have all this synthetic painkillers, and back in the day they used nature, and like French lilac French lilac was used for metformin for diabetes.
Yeah.
It was different things, that it was how the resources they had back then versus now that we're very technological and we need to create a synthetic form of everything. So, yes, there's part about politics and also part about culture, part about, if you go to Japan and say you want to try this extract, I'm sure you're going to be more receptive than trying some flower that grows in the backyard of Alabama, if you know what I mean. So,
yeah. Well, it's part of it is part of the training of, I teach history of medicine at University of Bridgeport, and one of the things I found was that doctors in other parts of the world are required to take courses in phytotherapy, which is what they call it across the pond,
Correct.
in these types of medicines. And particularly in Germany, they seem to be very advanced in phytotherapy, whereas doctors here don't even have to take nutrition in medical school. Did you take nutrition in medical school? I mean, you're a doctor. I could ask you point blank.
I think I did 8 hours in nutrition,
8
but it
hours.
wasn't real nutrition. It was just chemistry.
In naturopathic school, we take 1,600 hours of nutrition.
Yeah,
8 hours.
I think it was like 8 hours, and it wasn't more that much about nutrition. It was more about the chemistry of the actual, B12 and the rings, and you know what I mean, like that organic chemistry kind of convoluted thing that didn't translate well into how can you interpret complex carbohydrates into simple carbohydrates, and how does it affect lipids. So that kind of interaction was not there. I could draw the cholesterol ring, from the back of my mind, but that was about the extent of the nutrition I needed to learn.
Fascinating, yeah. So, speaking of carbohydrates, that's the active ingredient of these particular mushrooms. You said polysaccharides before, and they are a type of carbohydrate that has an ability to kind of sit on the receptors of some of the different types of white blood cells, particularly like the T cells. I know they're very important for viruses and natural killer cells, and then influence them in such a way that they're able to wake up, to keep it very simple, in simple terms.
Well, yeah, basically, you want three things when you're dealing with the immune system. You want a rapid response, you want an organized response, and you want a delayed response. That makes any sense. You want a rapid response to identify what's going on and try to shake it out of your body. That's number one. And then that's basically, you have chemical messengers we call cytokines, and this specific mushroom extract with other different immune supportive minerals and supplements, what they do is increase the amount of cytokines, so you have better communication between the innate or early response and the delay response of the immune system. Not everything is going to be shaken off from the first one, are going to actually trespass the first line of defense. And that's what basically you want to have, also a robust back-end immune system, but be able to communicate between the two. And that's one of the things that you need to have good cytokine numbers and good cytokine health to be able to communicate. You were talking about T cells. Yes. You want to also increase, their strength in numbers. If you have a weak immune system where you cannot create those T cells or those macrophages or those dendritic cells or natural killer cells, and to those who are listening, basically, these are the names of all the different components of, let's say, soldiers that go and attack the virus. They're different cells with different responsibilities and different mechanisms of action, but how they interact and communicate with each other, each one puts a little effort to destroy whatever comes in. And this supplement we're talking about actually increases and doubles the number and promotes it. But on the other end, you have to also be cautious that you have to have not only taking a supplement, it's going to make it better, it can improve your outcome, but also you need to have other components as well. If you're a smoker, you should decrease your smoking, and better yet, stop it, and try to have your immune system only attacking the virus and not busy trying to combat other damages that you're willingly doing to your body. And that's one of the biggest issues also too in modern society. People go binge drinking, go binge eating, go binge smoking, And
What
that
about
creates
sugar?
long-term effects and also decreases your immune system because
What about
it's
sugar,
fighting that damage.
Dr. Rushford? What about sugar? Sugar is like, I remember in school there was a study that when people ate sugar and they took out their white blood cells, the doctor called it, or the scientists called it, lazy leukocyte syndrome. It's like the white blood cells just sat there and they just like watched the viruses and bacteria walk by instead of being aggressive. Like usually when you look at your immune system under the microscope, it's like an amoeba. It's like patrolling. It has these pseudopods that reach out, like almost like how a gecko will shoot its tongue out and snatch an insect and drag it in to be digested. And that's usually what your immune system is, like a pack of hungry lions working the bacteria and viruses. When people ate sugar, the immune system just sat there and watched life go by. So sugar, I think, is a huge problem that isn't really discussed too much because of all the corporations that promote sugar.
I go a step further with the sugar. Like the more I got into the very nit and gritty with the athletes, I need to be very precise. For a professional marathon runner to decrease 8 seconds a mile,
we lost you there,
that's
Doc.
a lot. That's a lot. You have to be very precise and very, very methodical to make sure that you can put them in a sense that they can improve 8 seconds a mile. So with sugar, one of the issues is I do blame sugar because sugar gets converted into fat. You cannot get rid of sugar. You can get rid of fat, but you cannot get rid of sugar from your body in a sense, and it stores itself as lipids, as fat. But one of the things that also goes with that amount of sugar is the amount of insulin. And what I've noticed, and I do levels of insulin in every single patient I treat, and I've seen that the higher the insulin, the more inflammatory markers, the more fluid retention they have, the more cardiovascular disease they develop. The true steroid, an anabolic steroid, it's insulin. But what causes insulin to go up and starts damaging your heart? It's sugar. If you don't have an excess sugar, insulin is going to stay quiet. If you do exercise, insulin is going to stay quiet. The more insulin you have, the more issues you have. So it's a combination of both sugar and that insulin you have. And that's what a lot of studies like metformin are coming in and saying, look, metformin decreases the amount of insulin you produce and inflammation comes down. So a lot of the athletes also I've been using, especially in runners, I give them metformin, even though they're not diabetic, to help them lower their insulin levels and decrease inflammation. And as we know, as we age, we have chronic inflammation that develops into many different conditions. So that's my take on the sugar. There are two players in this case: the sugar and the adverse effects of high insulin.
I've been using extracts of Chromium and Gymnema, along with the bitter melon, which I know grows in Puerto Rico. I forget what they call it down there, but the bitter melon. I know they call it Sora C, I think, or something like that. Very good studies on that, having plant actually isolating plant insulin. So you were talking about
correct
insulin mechanism. I've seen that work tremendously in my practice.
There's a big study. Different studies pointing out to Alzheimer's disease or this dementia being type 3 diabetes.
Right.
And what they're seeing is that those amyloid plaques or those kind of dirt that deposits in the brain for the Alzheimer's patients, we never knew what it was. We call it amyloid, and we have different names through the years because nobody really identified. And now they're seeing that it's like a byproduct of insulin. So they saw that giving, obviously Chromium and metformin and different supplements that decrease the insulin, those type 2 diabetic patients, as they grow older, had less of a probability of getting Alzheimer's or developing that Alzheimer's dementia from lower levels of insulin. So it's very interesting how diet, like you said, sugar, can actually regulate up or down regulate or create havoc in the hormonal system. Insulin is a hormone. So how does what you put in your mouth can actually influence your hormonal system for the good or the bad? So I think that's a very, very good example of teaching the public and their listeners as to, 80% is what you eat and how you interpret what you eat and how you use it and what decisions you make at the end of the day, when you sit down at the table to eat something.
So that's what it seems like people should be kind of doing now to prepare for COVID and things like that. They should be focusing on what they can do instead of feeling powerless. And that's basically what the paradigm has created, a feeling of powerless, like you're only powerful by wearing your mask and staying away from social distancing, which is, again, it's part of the solution. Contagion. You don't want to go out and purposefully, drink a vial of COVID, of course. But
correct.
But, at the same time, there are things that for people to be proactive, and that's more of a preventive philosophy that's not being emphasized. So what should people be doing to prepare for this next wave of, they keep calling it a next wave. I don't know if that's a right idea, but...
Again, I think we should respect the condition and the disease, but we need to lose the fear of it. This is a promotion of fear, like COVID is going to kill everybody. COVID is going to be this havoc, uncontrolled, unknown virus. Even if we face something that is unknown, we need to take the fear out of the equation, because there are things that can empower people to do better decisions. Like, people, I have all the time in the world now. Okay, so sit down with all the time in the world and actually make better eating decisions. There's no reason why you cannot just go up and down the stairs or walk around the block with your mask and do some exercise, but the fear keeps them inside. The fear actually takes over their body, and fear creates stress creates disease, and then you have this ever vicious cycle of this high stress society of people getting depressed, people getting anxious, people going to abusing medication. I think the biggest selling now is medicinal marijuana. Like, people are going into cannabis to try to get all that anxiety down because they're doing great economically. I'm not saying that's not an option. I'm just saying that it shouldn't be the only go-to thing that you can do. You have so many things at your disposal, from just walking around the block with your mask and then just getting some exercise and trying to get all that anxiety away in different ways that actually can benefit you in other conditions. Because when COVID goes away, you're still going to have hypertension, cholesterol, and diabetes. You still have to deal with that. It's not like your clogged arteries took a pause, a vacation. They're not there anymore. You know what I mean? So people need to realize that whatever you can do, it helps other parts of your body too.
Right. And so, the other thing is the old saying that the Yellow Emperor said many thousands of years ago in the Neijing, which is, it's a foolish man who waits to dig a well when he is already dying of thirst. So in other words, don't wait, don't dig your well too late. Start now. So that's the whole prevention philosophy, Don't wait until you're coming down with the flu or COVID to start taking mushrooms and start taking your C and all your immune
No, again, you already have a lot of conditions that you're dealing with. Like, a lot of Americans have either overweight, hypertension, diabetes, some sort of cancer, pre-malignant conditions, pre-diabetes, something. This is not about COVID per se. This is about your health. And the media made it about COVID, and they forgot about their health. This is about your health that now is being impacted by COVID. So in a way that you understand that and you actually work towards your health, everything else is going to fall into place. And again, that's education. That's just having the day-to-day willingness of doing it and understanding that your health conditions are still there and you need to work with them. COVID is just, another step another step in your road, and you have to deal with it, but the health is already in.
So treat people, not diseases, basically, in a way. I mean, they're both important to look at the person who has the disease, not just the disease the person has. Focus on human-centered way to work on that.
Like, when I treat athletes, the most part, they're healthy. They're like in perfect health. But my mission is, how can I improve and make him more efficient? Or the other way, how can I make him recover better and have less stress? So even if you're in the perfect condition, there's always room for improvement in different things. Sleeping better, decreasing stress levels, taking some time to relax. The world took a pause. Let's take advantage of it. And, it's not sitting down on your couch feeling sorry for yourself and fearful for your life. It's just, okay, now I have a once in a lifetime pause in my life. What can I do to improve? I didn't have time for this. Let's do it now. I didn't have time to read that. I can actually go down and read it. I can go to vitamind.org, those societies, reputable sites, AHCC.net, and just read clinical information. You might not be a physician, but you can get the ins and outs of little things here and there and go to your healthcare provider and just challenging them. Look, why I'm not using this? How can I benefit from this? It's the same thing. So now people need to empower themselves with information, and we as society, as doctors, need to actually teach. And that's part of it. Our mission is not to cure disease; it's also to teach other people on and what things mean. Like we learn very complicated terms, but we need to take those complicated terms and teach our patients what they mean and how they can take advantage of good science, good medicine, good nutrition, gut supplements, and be inquisitive. They need to challenge themselves in this learning process that we're going through.
So are there any good research studies on the gut probiotics? Because I know you also have done some work in that field.
Yeah, obviously there are prebiotics and probiotics, fibers and bacteria. There are great studies on how they decrease and modulate what kind of inflammation you have in your gut. You depend on your gut to be healthy. You depend on your gut and have less inflammation. If you're eating a lot of high processed foods and a lot of different things, your gut is going to get inflamed. It's going to get that bloatiness, that uncomfort. You're going to get constipation. You're going to retain toxic things that you want to get out. The different types of probiotic, I'm very particular of how I use them. There's some that are better for digestion, some are better for inflammation, some are better for performance. In my field that I deal with more performance, I try to stay more with bifidobacteria strain. I use Bifilon, which one of the brands that I use, but not a brand, it's the stand for bifidobacteria. There are other places that sell lactobacilli. So for me, in the performance field, I stay more with bifidobacteria. For the digestive part, I go more for lactobacilli or a mixture of the two. And yes, you want to have your gut in the best health possible. One of the things that I tell people, the most important things with probiotic are prebiotic, that fiber that you can take daily. That fiber creates bulk. That fiber creates or exercises your gut. Your gut is a muscle that needs exercise. And the same way you can damage a muscle from overtraining and doing bad things, you can actually damage your gut from eating the wrong things or things that it can create allergies or any kind of process that can impede the normal transition from your mouth down to your colon. So you brought a very good point. You need your mouth to live, and that's where all the medication comes in. So that's basically my take on it when I give it to the pro athletes that I treat.
Yeah, it's interesting that more and more research on the gut, even controlling blood sugar. There's research on how the gut plays a role in Alzheimer's, how it plays a role in inflammation. This is an ancient concept that goes back thousands and thousands of years in Ayurvedic medicine and naturopathic medicine, but it's kind of finally percolating down into Joe and Jane, MD. Kind of looking at the gut.
Yeah, probiotics have been shown to actually help people with diabetes.
Yeah.
And actually control how they absorb sugar, how they can get rid of other toxic chemicals that their body produces. So yeah, like I tell my people that you need to have a healthy gut, meaning that it should be very thin and very malleable, and things can come in and out of your gut. It's like a big filter. You eat things, you digest it, and then those very prime nutrients actually have to diffuse themselves through the gut. If you have an inflamed gut, it's very hard for those nutrients to get into your body. And you have people that are obese, but they're not nourished. If you know what I mean, you can
actually measure that and look at their thing. Well, this has been a great conversation. How could the listeners get more information and get in contact with you if they want to ask you questions or read your articles or check your website out?
So I try to do mostly for Instagram, and I try to once a week get some lives to take very complex topics that people suggest through the messaging. and put it in very layman's terms. So I try to explain things so that people can get it in a sense. So my Instagram is FitBodyMD. And basically that's where I communicate with my, with the different listeners and everything, different shows that I do, and get feedback from them, what they want to listen, what they want me to research, from anything from, psychedelic treatment for depression to like the state-of-the-art hormones for improvement of sports. And I try to get those very complicated, highly technical medical journals and put them in like, the mom and pop words, so people can understand if they're good for you, bad for you, or how to use them in a good way or not to use them or avoid them because they can create harm in whatever conditions.
Well, thanks for being a great teacher and certainly a great guest here at The Natural Nurse and Dr. Z. Dr. Jaime Salas Rushford, wonderful, and thanks very much for helping us to understand a little bit more about our immune system and health in general. Appreciate it.
No, thank you for having me. And everybody keep safe. And again, it's about respecting COVID, not about fearing it. And, either COVID or something else in the future is going to come. We need to be ready, and we need to educate people on how to keep sanity and make the right decisions in our lives.
And we've certainly done that for this program. And so, listeners, until such time, we'll see you soon. And stay healthy, folks. This is Dr. Z signing out. Take care and have a wonderful week. Bye-bye.